The patient intake process has become a problem for a lot of providers in the market today. And it really resolves around patients not having a good experience when they arrive at the provider, or before they even get to the provider. The arrival process is very manual in that, and everybody knows about this, in that a lot of patients are handed a clipboard when they arrive at a provider's office. They fill out that clipboard, and as they fill it out and as they go through page 1 or page 2 or page 5 or page 10, that process gets disorganized. The handwriting of the patient even gets worse as they go through the form. So that the patient now is coming to a medical office. Obviously, they could be having a very bad procedure, cancer treatment, a very good procedure, having a baby. But either way, that process of manually having the patient go through a lot of paperwork up front can cause a lot of dissatisfaction for the patient. And we want the patients to have a good experience when they're at the office. The second thing that can happen is if a patient is coming into an office and they're not informed about that visit, and that information can be delivered while they're at the office. Again, it can be delivered before they get to the office. But if they're not informed about their coverage with that provider, whether it's in-network or out-of-network, they're not informed about the pricing with that provider. When we say pricing, not necessarily what the price is for a procedure, but more the transparency of what the patient's going to owe when they get to the provider. So they need tools, or they need ways to be able to go to a provider and say, what am I going to owe at this provider? What is my out-of-pocket responsibility going to be for today's visit? Is this covered? And that all happens when the patient arrives at the provider, rather than when the patient after the fact receives a bill for, let's say, out-of-network services, or a bill that the procedure was denied for some reason. So again, to restate it, the two sort of large problems for patients, or the two pain points for patients when it comes to going to the provider office, when it comes to pre-registering for services, when it comes to fulfilling all their paperwork needs for a specific provider, it's going to be the manual process of filling out all the paperwork. And again, the not having enough information about their visit with that provider, from a transparency perspective of what they're going to owe, whether they're covered, whether they're in network, whether they're out of network. And those are the two biggest pain points.